Yeah.
Hey there, Facebook. It's Matt Bradley from Rome, and once again, I'm the bearer of bad news. We got our fresh data from the Ministry of Health here in Italy, and it looks like the cases and the deaths are still rising at really, really troubling rates. We just saw well more than 600 people have died in the last 24 hours. That's not at that record-breaking high that it was last Saturday when it reached a global, worldwide record of more than nearly 800 people dead in one 24-hour period, but that's still really stubbornly high, despite the fact that there's been this 2-week lockdown that's kept all these Italians at home for this long time. And a lot of policymakers are wondering when we're going to start seeing the effects of the lockdown in the numbers. And there should be a lag. It shouldn't be immediate that we would see the death rate going down right after a lockdown was imposed, because a lot of those people who are dying, they contracted the virus weeks ago, before there was this lockdown. But the numbers that are showing that are really troubling to epidemiologists is that the number of fresh infections, the number of people who have tested positive for the disease, that's also rising. It was falling for the last 2 days, but now it's well more than 5,000, and that means that there are more than 80,000 infected people here in Italy. That means that probably by tomorrow, Italy will have passed China in the number of infected people. So, probably by tomorrow, by the time I talk to you then, Italy will have become the country with the most deaths from the coronavirus and the most infections, well ahead of China. It already has twice the number of deaths that China has. And remember, China is a country that's 25 times the size of Italy. So you can just imagine that per person, per capita, the impact here is just so much worse. But here's the weird thing. A lot of people are wondering, why is it that the infections have infected the northern part of Italy far more than the rest of the country? We're seeing the northern region of Lombardy that has about 2/3 of the cases. And here in southern Italy, well, in Rome, in central Italy, and further south, there haven't really been that many reported new cases. But that is just starting to change. Just in the last day or two, we're starting to see not a spike, but an increase in the number of transmissions and number of deaths here further south. So it's starting to level off, but it's something that policymakers in the U.S., they're really going to want to look at what happened here in Italy. Why was it that this disease spread so quickly through this population? Why was it that it only infected the north? And why was it that this lockdown that's now been going on for weeks, in months some places, has taken so long and in many cases hasn't really been seen at all in any of the statistics?